because there's already stress within these facilities. They're already dealing with a lot of challenges. You mentioned the reduction in workforce. And what we know from that is not just that people were quitting; there were actually people that were working in these nursing homes that were passing away. In fact, within the post-acute space or within the medical space as a whole, statistically, the post-acute space lost more people to death that were workers
Yes.
relative to every other space. And so they're losing people that are quitting, they're losing people that are passing away. And now we're adding on all of these additional regulations. What are some of the recommendations that you're making? I know you're doing a great job of highlighting this problem or this issue. What are some of the changes that you're recommending?
Yeah, well, of course, I love talking about solutions, and the last 4 chapters of my book, Broken, actually start to turn the tide, and I can't just bring a problem, right? I'm
Right,
all about
right.
like, here's the problem, but here's something we can do. And I'm also working on the second book, which is all about solutions, and it's
Mm,
even more catered towards the consumer and in helping them with these decisions as well, because consumers are so caught in the middle. They don't know what to believe, and you hear horror stories that happen, and they do happen. And so the solutions are like, how do we prevent these bad outcomes, and then how do we empower and equip consumers to really have the knowledge and understanding of what they need to help their loved one. And so that's where I'm headed, with my second book. But the solutions now are: number one, we need to have dedicated infection preventionist in the long-term care healthcare setting. It is a CMS requirement to have at least a part-time infection preventionist trained on site in every skilled nursing facility. The problem with that is many buildings I'm going into, I'm seeing it's on paper alone, but given the short staff issue, especially right now, a lot of those nurses are being pulled to the floor to work the floor. So ideally, at least part-time, if not full-time, because infection prevention to prevent the infections is really a full-time job.
yeah.
You can ask any infection preventionist in this country and they will say, I don't have enough time. I really don't, because you're talking about providing education and collecting data, and it's so vast. And so having that dedicated person. And I'm also pleased to say that APIC, which is the Association for Professionals in Infection Control and Epidemiology, they're really the nation's infection control association, have created an actual certification for long-term care. So it really distinguishes our long-term care professionals as the professionals they are. So that's the first thing.
Yeah, I think that's great. And I love how you talked about that. And you mentioned this in the later chapters of the book, how even though there might be a dedicated person, they're not working the floor as the infection specialist. And so I think that that's a really important point.